director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, MD.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health, heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and where we do encourage you to call in to join in. Today, well, it is a Friday version of the show. It is a get 'em up, out of town version of the show. In its best tradition, we're going to open it up to you today, allow you to come on in here and set the agenda. I've got a couple things on my plate I'll share with you. Whatever may be on your mind, could you please share it with us? And that usually does lead to some interesting programming around here. The number to be involved today and come on in and set that agenda is 412-825-6262. That's 412-825-6262. I'll be listening for your knock on the door, and I will let you in the store as soon as possible. I have composed some thoughts on a couple of items. One that we'll get to today, I've entitled it, and we'll call this show, at least the byline, backdrop for it, The Cholesterol Conundrum. Keep seeing things come across my desk that point to a real increment in how confusing the cholesterol issue has become. I'll share it with you today from my perspective. Of course, your perspective is equally important too. Once again, that number 412-825-6262 with any comments or questions you'd like to ask. Now, with respect to the calendar, we are moving along, are we not? With this month of December, it's clipping by us. We've had guest after guest here, and that's why it's so nice to be able to reach a point where we allow you to come on back in. But it's been an action-packed month up till now. It's going to stay pretty hot until we actually leave here for the year. Starting on Monday, Ed McCabe's going to be here. Now, you know him by another name. He's been on our show before. He's known as Mr. Oxygen. And, of course, he's going to be talking about oxygen therapies. He says, a new way of approaching disease. Let's hear from Ed again. I think it's been at least a year and a half or two since Ed's been back with us. And we will bring him to you on Monday. I'd like to see you here with us. The Wednesday's still wide open as we're approaching Christmas. On Friday, I will play. As you know, this is the Yuletide season, and we have that altercation with an elf. Those of you who listen to this station religiously know doggone well what I mean by that. Anyway, we'll share with that story with you on Friday, on Christmas Eve day, very appropriate. And then when we come back, we'll be going through our end-of-year shows. We usually do two, and so we schedule them for the 27th and 29th, where we take a trip down memory lane for year 2010, and literally month by month sort of walk through all the guests that we have had, and we've had many. We've done many interviews here, and things just pop up in my mind, and end up popping up in yours too, about, how things went on that day. And we usually spend the first 6 months review on one day, that'll be on the 27th, and the last 6 months review on the other day, which will be the 29th, and that will take us on out of here for the year. Then, just peeking into January, you already know that month is shaping up rather well. We come right back, right after the New Year's, with Cass Ingram. I talked to his public relations people just the other day, and Cass is energetic, and once again, he loves you, Pittsburgh. He really does. We enjoyed having him here a few months ago when he was the featured speaker up at the Freedom of Choice in Cancer Therapy group. I didn't have a chance to go up there. I was lucky enough to get a DVD of the proceedings, and I can see how enjoyable a time you all had. Anyway, Cass is going to be back, and we're going to cajole him into talking about one of his previous books, that he doesn't seem to go back to too often, but I know many of you out there would be interested in hearing from Cass himself what the natural cures for high blood pressure are. He wrote a book about it. I got a copy of the book. I've been delving into it ever since I received it. His publicist insists that he will discuss that on the 3rd. We'll hold him to it. Then on the 6th of January, she comes back. I'm talking about Dr. Susan Smith-Jones, very knowledgeable gal from out on the West Coast, who is going to be speaking to us about 7 stress busters. I'm interested to hear how she approaches that subject. On the 12th, Stuart Reeves comes back. He was with us once before now in the month of November. He was there at the birth of Epicor. Epicor comes from a company called Diamond V, a veterinary feed. Well, he doesn't like to use a veterinary. He says animal feed company that learned that their product had so much benefit to the animals that actually could benefit humans. That led to the discovery of something called Epicor, and we've been promoting it ever since. He'll be back on the 12th of this. Roland Thomas going to be with us on the 17th. A new guest talking about bioengineered algae. Doesn't sound too good, does it? But it's, according to him, soon to be our most powerful food and medicine. And then on the 19th, as I've been telling you, I've had a lot of discussions with the Trace Mineral Company, and Ionic Minerals are going to be on our agenda heavily in 2011, and we're going to kick it off with Darren Starkey, who represents Trace Mineral Research. Got all my package of information. We'll be talking a lot about that particular brand, and just we talked a lot on the phone when I spoke to Darren Starkey about his local supporter, one Mr. McWilliams up there in Indiana. And so, Mr. McWilliams, if you're listening to the show now, you'll want to stay tuned for the 19th. In fact, I think you should give us a call on the 19th and just weigh in when we bring Darren Starkey to the show. Of course, he represents the company. Okay, other things to mention. One, archives. I get a lot of emails, and for a while, there have been some problems with the archives. People were dialing up the shows. They were emailing me, telling me they really couldn't. They could hear me. I'm sort of a loudmouth. They get a chance. I'm talking, and then they cut to the guest, and they really can't hear me. They're going to turn up their volume. Then lo and behold, I come back in, and I scared the living daylights out of them because my voice level came through loud and clear. I think I rectified the problem. Please, those of you who this involves, if you're listening to me on the archives right now, if the audio quality has been restored, email me so that I'm certain that the changes I made were the absolute correct ones, because you should be hearing me and whatever guest we might have loud and clear now. So there's a public service announcement. Should mention Olbus products. This is that time of the year when we get the sniffles and looking for symptomatic relief. At least we now know this year we were introduced to Dr. Hannah talking about nasal washing is one of the great ways to keep the upper respiratory system clean. But whenever this thing of ours gets clogged, talking about the upper respiratory system, Olbus products will unclog it on the spot, especially the teas, something called pastilles, which they are definitely will wake you up in the morning. They have a more gentle form of these lozenges, which are blackcurrant in taste, but I prefer the real rough and rugged pastilles. Anyway, those are the two signature products. There are many other products, 8 total at least. If you're interested in getting any products, you can get them here at our office, but you may want to also do it from your home. I'm going to give you the phone number right now once again. Here it is. For Penn Herb, these are the people who really handle Olbus products throughout the entire country. They're located right here in Pennsylvania. The number is 1-800-523-9971. That's 1-800-523-9971. When they answer that phone, please tell them that you are from the Dennis Courtney Brigade. Dr. Courtney, DC, are the call letters to the codes that will get you the freebies there. Some always extra special things they'll pass on with you. Special discounts to products. as well as some interesting gifts that they'll be willing to give you if you just identify yourself with the call letters code DC for Dr. Courtney, and they'll be able to treat you just a little different because you'll be recognized as a friend. For the Spirit, we're getting to the gun lap portion. They're still able to, just talking to them the other day, they're still able to handle getting those gift boxes out to those who you might choose to receive them. Remember that special this month, Christmas gift boxing. You get for $29, which is usually just the cost of the product alone. Fruit of the Spirit, of course, that daily elixir from 14 biblical fruit purees, alkalinizing mineral from the Dead Sea, resveratrol. You know it well. Can't buy it in any stores. Will not find it. It is not sold in any stores, at least as it stands right now. The only place you can get it is right here. You can get it in our office. You can do it by calling them up at, where's our number? Oh, Fruit of the Spirit number, 1-800-793-8714. That's 1-800-793-8714. Or if you're techie inclined, you want to do it online, you go to this website, drcourtney.fruitspirit.com. And then you'll be plugged right into our own unique website, which is associated with the company. So there you go. What else? That's just about it for the public announcements and so on and so forth. Let's do this. We're opening it up to you today. We're allowing you to come on in and set the agenda if you care to. 412-825-6262. 412-825-6262 to do it. Take a short break. When we return, while I listen for your knock at the door, I'm going to get one thing out of my craw. This has been sitting on the sidelines for about 3 weeks now, and I'm going to explode if I don't relieve this pressure. I'm talking about they just don't get it, do they? Be right back with you.
Give your friends and loved ones the gifts of health with a very special gift from Fruit of the Spirit. Fruit of the Spirit combines 14 whole fruits with energizing minerals to give you great tasting, antioxidant-rich liquid nutrition with more health benefits than any other product of its kind. Take advantage of a special offer this Christmas. We will send a beautiful gift pack with a bottle of Fruit of the Spirit, portion glass, book, and brochure to each name on your shopping list for just $29. That's a bottle of Fruit of the Spirit, portion glass, book, and brochure to each name on your shopping list for just $29.
Fruit of the Spirit gift pack is a $57 value. This Christmas season, it's yours for just $29, shipping and handling not included. Call 1-800-793-8714 with your shopping list, and Fruit of the Spirit will take care of the rest. Call now. That's 1-800-793-8714.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you on this Friday version of the show. It is a get 'em up, out of town version in its purest tradition. You can set the agenda around here. Give us a call at that number, 412-825-6262. Anything on your mind is okay with me. Question or comment. If I don't know the answer, guess what? My listeners will. They will respond and help you out with whatever your health issue may be. One thing I have to get off my chest, because it's been lying on the side now for quite a while. I look at this article. This comes out of the Post-Gazette way back on November 9th. I saw it on the 9th, and I just put it aside. Every time I open up the book, this pops out at me, and I said, I got to get this issue talked about and off my chest so I can put it aside. The issue deals with cancer and cancer treatment. We consult an awful lot of patients here at the office on cancer therapies. We're so proud to be able to offer a pretty aggressive protocol when it comes to treating cancer in a non-toxic way with tremendous benefit to be obtained. And during the course of a discussion that I may have and do have frequently with the families involved with cancer, I always encourage them not to bypass that visit to the oncologist, even though many of them who come to see me do so to really specifically avoid that discussion. They do not want. They tell me right off the bat, I don't want to go talk to the oncologist because I'm not going to do chemotherapy. I'm not going to do radiotherapy, so why do I need to go? And once I'm certain that they're absolutely sure that they would not even entertain it, then they're actually right. However, there are the vast majority of patients who really are quite concerned about their state, and they are being scheduled, as we're usually speaking, to visit the oncologist. And I always tell them, look, be armed with two questions. Please go see the oncologist. Your type of cancer needs to be explained to you with respect to the treatment protocol that's available in the conventional medical model by an expert of that model, and that is the oncologist, and he should have answers to all of your questions. But in particular, there are two questions I always insist that it be asked. And it goes like this. You've heard me talk about them before, but this now leads up to an article that appeared on November 9th. But the questions are, question number one, Dr. So-and-so, Dr. Oncologist, with my type of cancer and my stage of cancer, what are the 1, 3, and 5-year survival rates if I elect to pursue the treatment option that you're recommending? And so, could you please tell me what the 1, 3, and 5-year survival rates are? And I will tell you, as I instruct those patients, don't look, if there's any hemming and hawing and tap dancing that begins at that point, you should feel uncomfortable, because that gentleman or that lady knows exactly, specifically, the answer to that question. That is their literature. I don't know oftentimes, and I don't claim to even guess what the answers to those questions are, but the question has a definite answer in terms of survivability. What are the 1, 3, and 5-year survival rates? This is how the literature is written. By the way, there are no such things as 7, 9, and 12-year survival rates. There's nothing over 5 years because, as I mentioned the other day with respect to Elizabeth Edwards, who survived for 6 years after her diagnosis. After the 5th year is up, no matter what your state of health might be, you are considered to be a home run in the eyes of conventional medicine, because they don't keep any statistics or data after that. So, okay, question number one is, as I've stated. Here's question number two that I ask them always to pose to the oncologist. Okay, doctor, thank you very much. You've recommended a treatment. You now just have told me what the 1, 3, and 5-year survival rates would be pursuing the treatment that you've recommended. Now I have question number two, doctor. It goes like this. Doctor, with my form of cancer and my stage of cancer, what are the 1, 3, and 5-year survival rates if I elect to do absolutely nothing at all? I mean, I do nothing. And I just go home, and I don't do your chemo, and I don't do the radiotherapy. What are the 1, 3, and 5s for that? Well, I can also tell you that the oncologist has at his beck and call, at his fingertips, at the tip of his tongue, the exact answer to that question, and make sure you don't leave that off until you get it. And then, in a rather facetious manner, I say, now before you leave to visit the oncologist, let me already give you the answer to that second question. And the answer to the second question is there is no difference. There is absolutely no difference as to whether you pursue the treatment that is recommended by the oncologist, utilizing chemotherapy and radiotherapy, or whether you do absolutely nothing at all. And I mean nothing. Of course, in this office, we're not talking about doing nothing. We have a whole protocol that we're going to proceed. So, but if you did nothing, the answer is there is no difference in longevity. 1, 3, and 5-year survival rates do not change as to whether you do the proposed treatment recommended by conventional medicine or not. Now, there, of course, are repercussions and a downside. The risks, side effects of doing conventional medicine makes quality of life issues absolutely impacted on, and that is really the point that if you did nothing, probably your quality of life, not probably, absolutely your quality of life would be at a much higher level than it would be if you proceed with them because of the devastating consequences of the treatment. Okay, there's the setup, folks. That's it. That's the setup. And I'll get to the caller in just a second. Wait, don't go anywhere. So this article comes out on November 9th, and you can remember it because it's talking about a prostate treatment. The drug that was being evaluated was called Provenge, and it was a treatment for prostate cancer. One of the treatments that was available, and it, I guess still is, they say the treatment cost over $93,000, and the patient that perceives it has been shown to extend their lives by 4 months. 4 months. As you can see, the issue of being no difference, whether you did nothing or whether you do something, is the same. The fact that 4 months could even be written about. And I'll tell you, the oncological community out there is wearing saddle shoes and shaking pom-poms over that 4 months. They think this is the greatest thing since sliced bread. Goes to prove, doubly sure, that they just don't get it. Hey, any comments on that? I'd sure love to hear from you. We do have a knock on the door. Come on this door, and hello and welcome aboard. What's on your mind?
Good morning, Dr. Courtney.
Hi.
Boy, that sounded like a successful drug.
Yeah, but by the way, they're out there. The oncologists are out there singing the praises of Provenge. It just didn't get approved. The article of November 9th talked about how Medicare wasn't going to approve the drug. They felt that the $93,000 really wasn't worth it. And boy, if there ever was a case for how $93,000 can be just tossed away, that's the case. But the fact that they don't get it, and they can actually come out and support a drug that gives you 4 months of life based on side effects and consequences to the drug we won't even talk about, goes to prove they just don't get it. What's on your mind today? I'm always waiting to hear from you. What do you got in your mind?
Yeah, I had a couple questions. One was just generally speaking about pregnenolone.
Sure. The mother load, the mother hormone.
Yeah, I guess it's a precursor to the progesterone.
It's a precursor to a whole host of hormones.
Even male hormones, right?
Oh yeah.
Well, what's your recommended dose, just generally speaking? I know, everybody's probably an individual, but generally speaking, for a woman, what would be, who's like 40, what would their, maybe a general...
Yeah, as pregnenolone really is, and it is an over-the-counter substance, so to the extent that it is in that category of precursors, is another name it's also used for it. But these are harmless because your body either utilizes them or they don't. You asked me for a dosage. Well, I'm going to say about 100 to 300 milligrams a day.
Oh, really?
Yeah.
Okay. I started out at 25 for the longest time and then bumped it up to 30 and then just recently bumped it up to 50, and I take it, about an hour after my thyroid in the morning.
Well, these, and the word I was searching for are called secretagogues, which is like another synonymous term with precursor. The good news for them is you can't overdose on them, okay, because whatever your body doesn't end up using, you're going to be able to excrete, whether it's through the urine, the excrement, whatever.
My kidneys are functioning, right?
Yeah, you're the diabetic we always talk about. By the way, how are your kidneys functioning? How are they working?
The creatinine level is up there.
Okay, well,
Creatinine and urea, it's up there. The
Here-
protein in urea.
here's the good news. Because this is an oral supplement, it's being eliminated by the liver anyway. Did you know that?
No.
Yeah, it's the IV route and the sublingual route that completely bypasses the liver and is completely eliminated by the kidneys. But if you take anything by mouth, the first place it goes is to the liver, and a whopping dose going in means only a small amount's coming out, and the metabolites are eliminated from the liver. So you don't have to worry about your kidney issues when it comes to that substance, all right?
Okay, and then another question was, now I'm going back a little bit again, whatever happened to, one of your things, and this goes back maybe to 2004, do you remember the company Yasu?
Yasu?
Yeah, you had the doctor on.
What did the company make?
He had vitamin E, and he had a high superior antioxidant formula.
Boy, I remember the people from Unique E.
I almost want to say Yahoo, but it's like, Yahoo. But
Yeah.
Yahoo. You had, and I can't remember the doctor who's affiliated with that company. He's basically, I guess, the whole,
all right, well,
I remember even Deborah Ray, I think, at her time had him on.
Well, I know when it came to vitamin E, and still probably in your lexicon, Unique E is always put at the top of the list.
Yeah.
I don't recall. I actually don't recall.
California.
2004. What a memory you have. What about Yasu?
I used to take, my mom got me the product. Vitamin E, it was called Vitamin E Factor, Maxi Gamma Tocopherol, and then a separate formula called Antioxidant Factor. It has CoQ10, alpha lipoic, phenols.
That's a unique little ingredient to vitamin E.
I just wanted to know if you had an update on his company.
Well, first of all, I'm trying to refresh my own memory and haven't done it. So, Yasu. You know what? I think because of the Yahoo comparison, I do remember the name. I don't remember the doctor. I tell you what I can do, though. What I'm going to do after the show today, I have my radio show book from 2004. I'm going to go through there, okay?
Yeah.
And I promise to have another discussion about this. You have to give me the opportunity to go and check on it. You sure about 2004?
I'm sure you keep a Rolodex, don't you, of maybe past people you've had on?
All in that book. Every year, right now, because we're in December, I'm just getting my brand new 2011 book. So each and every year, I have a book that I put all my shows in, all my guests, all their phone numbers, and I'm going to go to 2004, and I'll find it, and I'll tell you more about it when I've done so.
Like I said, I think he was also on Deborah Ray's show back, when she used to be on.
That's right. 2004, she was still in the game. By the way, what'd you think of Deborah Ray? Did you listen to her the other day when she was on the show?
Yeah.
Great hearing from her, wasn't it?
Yeah, it was.
Really nice. Well, thanks for hearing from you. I'm going to do some research on the Yasu thing.
Okay.
And pregnenolone, don't worry about any kidney complications because you're going to eliminate that through the liver. Always oral things are, by the way. And sublingual stuff is going another route.
And real quick, did you happen to see on the news about the silver amalgams?
Silver amalgam? You mean mercury-laden amalgams? Is there something new?
They should be not. If you're pregnant or nursing or if you have a serious health issue,
don't do anything with them for the moment? Is that the advice?
Consider having the mercury amalgam.
Don't consider having them done now. That would be the advice. Is that it?
I guess.
Yeah. I mean, it would be my advice that if you had mercury amalgam fillings and you were pregnant, the worst thing you could do is have that condition rectified while you were pregnant. And the reason, of course, is even under the best of hands, utilizing even what we call the Huggins protocol, your exposure to mercury is going to be monumentally high during the procedure. And you're going to be exposing then the fetus to that kind of exposure at an inopportune time. Better to wait until the pregnancy is over with, then seek out the help of somebody who's Huggins trained. And that way, even though you are going to get a high wallop of mercury at that time, you won't be afflicting others. And that baby on board is something I always keep in mind. So
funny, I was impressed to see that on the news, that it's finally coming out in the mainstream news. However, they interviewed one dentist who actually is saying that amalgams are bad. The mercury amalgams are bad. because you're offloading it into your system over time. But then they had a completely opposite dentist point of view who said there's such a small, minute amount of mercury in the amalgams, it's not going to cause any detriment. Of course they there.
I pretty much I move around through the dental community quite a bit, and at this point, whenever this issue comes up, I can tell you that they can't even look at you with a straight face and have a conversation. Those that attempt it don't do it for too long, trying to say how safe mercury is, because they intuitively you should already know it. But as a scientist, it would just be absurd to try to back it up. The fact that the dental community as an institution continues to support the use of mercury amalgams as a safe product and how they get away with it is far beyond me. But the individual practitioners know better. They don't use it anymore.
Okay.
Nice to hear from you.
Merry Christmas.
Have a great holiday. Yeah, absolutely. Nice to hear from you. There you have it. Always interested to talk to that young lady. I know her personally. That's why we could talk about her own medical history so well. Over these years now, we've become great friends. Another knock on the door. Come on, the store. Hello, welcome aboard. What's on your mind?
Yeah, Dr. Courtney.
Oh, yeah.
You mentioned at the opening of the show you were going to have Dr. Starkey on from Trace Mental Research.
Is this Mr. Ferguson?
McWilliams?
McWilliams, excuse me. Hey, welcome. Yes, we are going to have him on. I finally did reach your mentor.
Yeah.
The other day, I got a whole bunch of information he sent to me on the company and the product line. We spoke. He's going to be, by the way, Mr. McWilliams, he's going to be our guest in January, on January 19th.
Oh, okay.
And when I was talking to him on the phone, I said, you know what, I'm going to invite, and I'm inviting you now so everybody can hear, I'm going to invite you to weigh in and come on aboard on that 19th, because I understand you and he are great friends anyway.
Yeah.
That with respect to how much success you've had with using these trace mineral products, you, as I told Dr. Starkey, are the poster child for trace minerals research. They probably have photos of you plastered on the opening in the opening foyer of the company because of your success with that product. Well, you were able to literally to correct, if I remember correctly, correct your arrhythmia, AFib, in what, hours or days or some phenomenal. How long did it take to do it?
Yeah, it took 10 days.
10 days.
10 days.
Well,
it was a continual improvement each day, and on the 10th day, I was put down to eat lunch, and all of a sudden, a great calm came over me, and the AFib was gone.
Well, that story, which we've enjoyed hearing, and many, in fact, it was the very listener who just hung up, who had mentioned on the show the day last time we spoke, hey, there's a gentleman out there, his name is Mr. McWilliams, and he had AFib, and so you called up that day, and it turned out to be a nice little interplay. In fact, I can tell you it was that conversation that led me to contacting and developing a relationship with Mr. Starkey and with the company. He knew you very well. Obviously, the company knows you very well. Your story is not just folklore anymore. It is well ingrained, probably in the training manual of anybody who represents the company. Please make sure. Well, I know you listen all the time, so
yeah.
You'll be listening anyway. But give us a call on that day, and we want to put all three of us in contact with one another, at least for a few moments, because that's the day I'm going to be launching that product line in my office.
Well, that's good.
And I already know that out there, if you're out there, folks, if you're in the Indiana area and you need a passport or you need some quick photos, you need to come to Mr. McWilliams. Give us your phone number.
It's 724 354
354
2994.
Okay. Once again, so they all can write it down. If you're in the Indiana area, I want you to see Mr. McWilliams, because you have a line of products right there in your store, don't you?
Yes, I keep the trace minerals here, and the magnesium, and some selenium, some zinc, and some basic minerals. Okay,
so if you're in that area and it's geographically desirable for you to see Mr. McWilliams, please give him a call. Go get a picture taken, and you'll kill two birds with one stone. You get your minerals done too. Once again, that phone number, sir.
Yes, area code 724 354 2994.
All right. stay listening, as I know you always do, and make sure you report to us on the 19th of January. Have a wonderful holiday, sir.
Okay, and we'll talk to you then.
All right, absolutely.
Yep.
Okay. There you have it. Hey, yes, it was that conversation on that day that led to me trying to contact this Dr. Starkey. I thought I was talking to him in Utah because that's where the company gets all these great products from, the Great Salt Lake. Nah, he's in Virginia. It's like the next episode. And he'll be with us on the 19th of January. Another knock at the door. Come on the store. Hello, welcome aboard. Anybody else out there? Hello?
Hi, Dr. Courtney.
Hello, what's on your mind today?
Hey, I was wondering if that caller that was looking for the doctor's name from 2004.
You remember you know the
I
doctor.
went to my library because that sounded familiar to me, and I have the book, and I think she was referring maybe to Andreas Pappas.
Now, Andreas Pappas is the fella who represents Unique E.
Yes.
Vitamin E. And I don't think that's Yasu. If it is, then it all makes sense to me because I've always associated vitamin E with a product called Unique E, and that the person who always would come on my radio show was Dr. Pappas. He was the most knowledgeable gentleman on vitamin E in the world. Is the company Yasu that he represents, really?
I think I'm looking through the book, and I just can't find that real quick. But I think that rang a bell with me when she said that.
All right. Well, the vitamin E and Dr. Pappas absolutely resonates with me. I already associated the two. But I thought that's the AC Grace Company. The AC Grace Company is the person that manufactures. By the way, it's the only product that they do manufacture. They only have one product. That's Unique E. And so this Yasu, I will promise you as well as the previous caller that I'm going to go back on my 2004 book. I'll find that Yasu thing and I'll bring the doctor's name. If it's not Dr. Pappas, I'll say so. And if it's somebody else, I'll mention their name and the numbers. Okay?
Okay, I'm pretty sure it is, though, but I'd have to...
I always like when my list... Your memory is unbelievable. 2000...
No, I went to my books because I have his book.
Let me ask you about this book. What's in your book? What do you do?
It's called the Vitamin E Factor.
Oh, okay. You have a book. You don't... While you're listening to the show, you don't take notes or anything like that, do you?
Yeah, I do.
Well, you're supposed to just enjoy the show, but I take it as a compliment, as well as anybody else who has a show here on KHB. That would be very complimentary if you actually take notes, because what we are doing, each and every one of us, we hope, is teaching. And if you're learning, then it makes our job worthwhile. Makes me feel good.
Okay.
Thanks for the call.
You're
Have a
welcome.
great holiday. See you in
You too.
2011.
After Christmas.
Okay. There you have it. All right, folks. Nice to hear things like that. Pretty sure that Unique E is the company associated with Dr. Pappas, but I will pursue 2004 and I will come back with an answer. All right. We have opened it up to you today. We're allowing you to come on in the store and set the agenda. 412-825-6262 will get you on in here. When I hear a knock on the door, I'll let you in. Well, I just heard a knock, so come on in. Welcome aboard. What's on your mind?
Morning, Dr. Courtney.
Oh, yeah. Good morning to you.
My recollection also, that lady's spot on, and she is not the only one that takes notes. This is your free classroom. You ought to be charging.
Yeah. Well, I know you out there taking notes. By the way, what you don't know is when you speak, I also take notes listening to you.
Oh, my goodness.
Oh, yeah. I write it down.
Well,
but what do you...
Compliment. I will say my recollection also that Dr. Andreas Pappas is associated with Yasu.
Oh, really?
He was, as far as I know, and may still be affiliated with Eastman Chemicals, and did his pioneering work on, I guess, the molecular distillation of vitamin E products there. And I think he has a son that's a doctor, I don't know whether a PhD or a medical doctor, but I think they needed to get these vitamin E products out to the consumer, and because Eastman Chemicals deals more with the industrial side of things, they created Yasu.
Really?
Yeah, and so Yasu, now I haven't talked to anybody from Yasu in quite some time, too. And I did get their vitamin E factor book. It is a very, very, it's definitely a reference book.
Well, isn't that the one Dr. Pappas wrote himself? That's Dr. Pappas's book, right?
Well, yes, that's his book.
Okay.
And I would say that maybe this is a good place to revisit, because I can always remember reading about the Shoot brothers from out of Canada, and their pioneering work in vitamin E. And it seemed to me, and I don't know whether I'm right or wrong on this point, but I think vitamin E used to be a lot more of a crude product and had tocotrienols and so on and so forth in it. The Shoot brothers always got fabulous results, and they wrote about heart health, which was, I think, an archetypal book on the subject. And I find it in bookstores, old bookstores, occasionally I'll see the vitamin E and the Shoot brothers. But in any case, since they've ultra-refined vitamin E and, of course, came out with that racemic DL tocopherol, they're not getting the results they used to get, or at least what they can't duplicate what the Shoot brothers was able to do like 50 years ago. And but now, of course, there's focus on the delta tocotrienols and
the gamma tocopherols, right?
Well, there's tocopherols and the tocotrienols. And
tocotrienols and tocopherols, absolutely.
And now they're focusing on the individual ones as to what, and they're getting some very interesting outcomes from just using these very specialized products of vitamin E. You know, I don't even know that anybody out there outside of Dr. Pappas, when you say vitamin E, what the heck you're talking about, you know?
Well, at one time, and it wasn't too long ago, there was only one ingredient in vitamin E. That was the old D-alpha tocopherol. Remember when that was the sole?
Yes.
That was the sole one?
I think the Shoot brothers was using a very crude extract, and they actually had the whole family when they were using their vitamin E was just more crude extract. Then when the Eastman, I think Kodak and Eastman Chemicals, of course, they developed the molecular process, and now they can separate it out real fine. And I think since they've just focused on D-alpha tocopherol, they weren't getting the results that the Shoot brothers was getting.
Yeah, if you say the Shoot brothers, who I'm not as familiar with as you appear to be, were always using a whole family of them. I got a feeling that when everybody else was using D-alpha, they were using the entire family of the alphas, the deltas, and the gammas, and the tocotrienols, and all that.
Yeah, that's my impression.
Yeah, that would make sense. Yeah, that would make sense.
Severe heart disease.
That's right. Now, Dr. Pappas, to make because you actually cleared up the problem with Yasu. I always trust you. If he represents Yasu, I'm going to take. I'm not even going to go to my books. I think you've solved that issue. Did he also represent the AC Grace Company with their product called Unique E?
You know what? You have me there.
I'm pretty sure he does that too.
Product, but I don't know who's behind it. But you may
very
well be right about that.
That's what I'll go check. I'm pretty sure. Anyway, I think everybody agrees. Dr. Pappas in that book of his, who we did have on the show multiple times. He is the most knowledgeable one on the subject of vitamin E worldwide. I don't know about the Shoot brothers. Maybe we're going to put them in the same league. I think we ought to. But I think this issue is now resolved, and it only takes but about 1 or 2 calls to get the whole thing worked out on this show. Thank you for your contribution.
Answer your question for me, sir.
See if I can.
Okay. They were talking about delivery of vitamin C 24/7 using a pump and a PIC line. Just what is a PIC line?
Okay. PIC. The letters BICC are an acronym for percutaneous intraluminal something. Okay. Yeah. Okay. What it is a fancy word for an IV line that indwells and remains in place 24/7. So, for instance, if someone would come to my office and just get an IV, we use a peripheral IV. We start the IV. When the IV is done, we pull out the line and we put a little piece of bandage over top of the wound that we created, and it's done. Well, with the high doses of vitamin C that are required for treating cancer, and you're obviously referring to the comment made by Deborah Ray the other day, when I asked her how things were going this year, and she said, really great. There are 3 close friends of hers that beat cancer by using this continuous vitamin C IV with a PIC line. And I didn't take time enough to describe what the PIC line issue was, and so thanks for asking the question, really. But
is this an insertion insertion in the arm or some other?
The usual place of insertion is done in the antecubital fossa, which means at the elbow. Okay.
Okay.
So on the outside, and by the way, these are done in a hospital in the radiology suite, because the catheter on the outside, which looks like any catheter, any IV catheter, when you hook up to it, it just sticks out from the skin just a bit, you know, maybe a ½ inch. Well, that remains the same, but the catheter itself in a PICC line is threaded from that elbow site. The tip goes all the way up to and at the level of the opening of the heart. So it's about a foot. The catheter is about a foot long. All right.
Wow.
And the reason why that's so is that if you don't use a PICC line, you can't use doses of over 50,000 milligrams in an IV, because the material, although it is not harmful to tissue, it is still irritating to a peripheral IV because the caliber of the vessel can't accommodate such a highly concentrated substance. However, by the time you reach the level of the heart, the size of that vessel is about the size of a garden hose. And there's no worry about irritating the lining of the vessel. And so consequently, the line stays indwelling, stays in place for, hey, I have some patients that have had the PICC line remain for up to a year. Okay? And then all they do is we train them how to do their vitamin C administration. We train members of the family, and we actually, after we've completed the month here in the office, send them home to do that at home. And that, the continuous around-the-clock vitamin C, which, by the way, what kind of vitamin C would it have to be? Non-corn derived. I know you would know the answer to that, okay? Non-corn derived vitamin C given in those doses of 75,000 milligrams, 100,000 milligrams a day really do change the course of the cancer, because vitamin C at that level will kill cancer, and only the cancer, and it will not harm in any way the other tissue of the body, the normal and healthy tissue.
Is this something, though, I know you have expertise in chelation therapy, is this vitamin C also blended for, was it osmolarity?
Osmolarity. You're very interesting, because you pick up on these little nuances that most people don't, okay? But let's just say we mix up a bag of chelation therapy in sterile water, which has no osmolarity to it, right?
Right.
So everything we add, when we're doing chelation, we put in vitamin C to bring the osmolarity up to between 272 and 292 milliosmoles, and I know that you know that that is an isotonic solution. Well, you need to do that when you're starting out with sterile water. When you use vitamin C IV, you don't use sterile water. You use D5, and it already has quite a bit of osmolarity to it, and you don't have to worry about calculating in terms of reaching the isotonic level of 272 to 292 milliosmoles. And I know you're the only one out there that understands what I just said, but
I hope the audience isn't snoring.
yeah, I hope they don't go to sleep on that one. But
this protocol, would it be available through your office?
Oh yeah, absolutely. We treat a number of cancer patients here. They're so happy to be able to have an option other than the conventional option. Many people already know that. They're coming here, and many times I even want them to go. Please go to the conventional doctors. You need to have them at least evaluate you. You may qualify to have a surgery. They tell me, I'm not doing it. And once they insist, then their role and their decision is to be honored by me, and it is 100%.
And you actually do you have access to this 24/7 pump that they are?
Oh, you don't need a pump. It's just gravity. It's typical, just an IV. The fact that it runs all day.
Oh.
Okay, doesn't have to run at night. It just runs all during the day, because that's when you can slow drip it in. You can do this procedure throughout the entire day because you're at home. Okay, you're able to do it. It's not as though it's a concealed device that you can go out and walk around the streets with. No, you're going to be within your home, but you don't have to be in a doctor's office. You certainly don't have to be in a hospital environment. We teach patients as well as family members to how to mix up the IV, so it's a fresh IV every day. And we observe the patient once a week to make sure the catheter is maintained without any sign of infection, and it works rather well, very well.
Well, I would like you, I mean, if you have the opportunity someday to maybe discuss some of the outcomes that you
Oh, we have,
observed.
yeah, we have, absolutely. I promise to do that. It has been very interesting to me on how we have, how well patients have responded, and we use science to just to pick up on this a bit. We're going to be using science on the way in and the way out. So, back in the day when we first started to do this protocol, do you realize PET scanners, which PET scanning is the gold standard to detect where cancers may be in the body. By now, pretty much even the entire public, for sure the medical community, all knows what a PET scan is. But back in the day, there were only 2 hospitals in the entire western Pennsylvania area that had PET scanners. One was the Hillman Cancer Center up there, in the Shadyside area. And the other, of all places, was Jefferson Hospital, which was pretty interesting to me. But at the time, not very many people knew what a PET scan was. I sure did. I ordered a scan, and I mention it now to you because we get a PET scan before we start, and we get a PET scan after we've finished, because we're looking to see that the signature, the X-ray signature, the radiographic signature of the cancer is extinguished before we know we're done. But we have science to tell us when we have arrived there. And so we're not going on a wing and a prayer. We're not going on a belief system. You have to, to believe that this will work. By the way, belief systems are great, but I need science behind me. So you do a PET scan before and a PET scan after, and you'll know whenever you've conquered this disease. You'll know it 100%. And so in that way, we do an aggressive 1-month protocol here in the office. And after that, we've taught the patient so well and family members so well they can carry on at home. And I was happy to hear from Deborah Ray that 3 of her close, I don't know if they were family members or friends, it didn't quite come out in the conversation, but 3 people close to her beat cancer in 2010 by using indwelling PICC lines to administer non-corn-derived vitamin C throughout the entire day, and it is just that effective. It works that well.
That's amazing. There should be something in the media about that, and plus you're not initiating. A lot of these chemotherapeutic approaches initiate other secondary cancers down the road, and you're not going to get that sequelae.
Absolutely. No, because there's no toxicity with this is vitamin C we're talking about, folks, and because literally it certainly won't harm any of your good cells. In fact, it'll make all your other tissues super cells.
Right. Robust.
I mean, absolutely. But it will only attack the cancer. And the mechanism should probably be, so how is it then? How is it that the vitamin C administered can actually kill only the cancer? How does it know? And not harm the good tissue? Well, the fact of the matter is this, that normal cells work in an aerobic environment. They're oxygen driven. All the cellular functions are driven by the supply of oxygen. The contrary, however, is the case in a cancer. Because in a cancer, they are driven anaerobically. They have no oxygen requirement whatsoever. If there was an oxygen requirement, they would extinguish themselves because their metabolic rate is so high, they would consume the oxygen, and once it was all gone, it would be done. But they're anaerobic beasts, and consequently, they survive in a non-oxygen environment. Vitamin C in an oxygen environment is a very potent antioxidant. So here we are to the chemist. In a non-oxygen environment, becomes a deadly oxidant, and it actually kills the cell through a hydrogen peroxide generation mechanism that we won't have to get into right now.
Yeah.
But
Science Wrap has a booklet out that goes into even some other avenues that the vitamin C may also function in eradicating cancer. But I think what you're talking about is the primary one.
It is the primary one. And I say one other thing about it. I mentioned it whenever Deborah was on the show the other day, and I did have a patient, or not a patient, a listener take me up on it. I'll offer it out there for anybody who wants to take me up on it again. And we in the alternative realm have known how this vitamin C mechanism works for a long time. We never did think that we were going to get any verification of this from the conventional medical community, but lo and behold, back in 2005, at no lesser an institution than the NIH and NCI, and you know what those letters stand for, did research by Dr. Michael Levine, who proved and showed the mechanism of how you kill cancers with vitamin C. It comes right out of our NIH, NCI. I kept the copy of that article. I keep it in my desk. I give these copies out to every cancer patient that comes in to see me. And I think you out there in the listening audience, you in the public, need to be armed with the proof that has already been done by our conventional medical community in terms of research. Yes, it's proven. Vitamin C does kill cancer, and they all know it, yet I'm afraid you're not going to be hearing much about it.
Bad commentary.
Bad commentary, accurate, and unfortunately, we'll be spreading the information here. You'll get the accurate information here, but you'll never hear about it in the conventional world. It just won't happen.
Well, again, the importance of someone out there communicating this information, and thank you for your show.
Well, thank you. I'm done taking notes. Thank you. You straightened out the Yasu controversy. I'll check with Dr. Pappas with his relationship with vitamin E. You have a wonderful day and a wonderful holiday. We'll see you at the beginning of the year.
You also. Thank you.
Okay. Here you have it, folks, a crescendo moment. The bongos are in the background. Well, you know what that means. It signals our time out of here today. Really enjoyed spending time with you. Look, I promise to bring the conundrum, the cholesterol conundrum, back to you before the year is up. Probably do it next Wednesday. Until then, this is Dr. Dennis Courtney saying so long for AM Impact on Your Health.
AM Impact on Your Health is sponsored by Dennis J. Courtney, MD, Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or